Welcome to our health series. Today, we're talking about yeast infections, a common issue that affects many women at some point in their lives. What is a yeast infection? A yeast infection, or vaginal candidiasis, is a fungal infection causing irritation, discharge, and intense itchiness in the vagina and vulva. It's not a sexually transmitted infection, but can be more common after starting regular sexual activity or with oral-genital contact. Up to 3 out of 4 women may experience it during their lifetimes, with some having multiple episodes. What are the symptoms to watch for? Symptoms include itching and irritation in the vagina and vulva, a burning sensation, especially during intercourse or urination, redness and swelling, vaginal pain and soreness, a rash, and a thick, white, odor-free discharge that might look like cottage cheese. What are the risk factors? Factors increasing the risk include using antibiotics, increased estrogen levels, pregnancy, uncontrolled diabetes, a weakened immune system, and using hormonal contraceptives or hormone therapy. Other risk factors are tight or non-breathable clothing, douching, scented feminine products, hot tubs or hot baths, and staying in wet clothes for too long. How is yeast infection developed? These infections occur when there's an overgrowth of the fungus, Candida albicans, in the vagina. This overgrowth can happen due to antibiotic use, pregnancy, uncontrolled diabetes, a weakened immune system, or hormonal changes. When to see a doctor? It's important to see a doctor if it's your first infection, you're unsure if it's a yeast infection, if symptoms persist after using over-the-counter treatments, or you have severe symptoms like extensive redness, swelling, and itching. Also, see a doctor if you're pregnant, have uncontrolled diabetes, a weakened immune system, or recurrent infections. How to diagnose yeast infections? Diagnosing a yeast infection involves a doctor asking about your medical history, a pelvic exam, and testing vaginal secretions. This helps in prescribing effective treatments, especially for recurrent infections. What are the potential complications? Complications can include recurrent infections, more difficult to treat infections in those with weakened immune systems or uncontrolled diabetes, and in rare cases, the infection spreading beyond the genital area. What are the prevention tips? Preventive measures include wearing breathable cotton underwear, avoiding douching and scented feminine products, not sitting in hot tubs or hot baths for long periods, practicing safer sex, wiping from front to back, not staying in wet clothes, and being cautious with antibiotic use. What are the home remedies and treatments? Home remedies include using probiotics, eating unsweetened yogurt with live cultures, using boric acid, diluted apple cider vinegar, tea tree oil, and maintaining good hygiene. Over-the-counter antifungal vaginal creams or suppositories are commonly used for treatment. In cases of recurrent infections, a longer treatment course and a maintenance plan may be necessary. What are the professional treatment options? Depending on the specific needs and medical history of the patient, healthcare providers can create personalized treatment plans. This might involve a combination of medications and lifestyle changes to manage the condition more effectively. Prescription antifungal medications. For more severe or recurrent yeast infections, healthcare providers might prescribe stronger antifungal medications. These can be in the form of oral pills, vaginal creams, ointments, or suppositories. Examples include fluconazole, an oral medication, and interconazole, a topical treatment. Long-term medication regimen. For those with chronic or recurrent yeast infections, 4 or more in a year, doctors may recommend a longer treatment course. This could involve taking a yeast infection medication once a week for 6 months or longer to prevent the recurrence of infections. Identifying and treating underlying conditions. Sometimes, recurrent yeast infections are a sign of an underlying health issue, such as uncontrolled diabetes or hormonal imbalances. Treating these conditions can help reduce the frequency of yeast infections. Maintenance therapies. For chronic yeast infections, maintenance therapy may be recommended to prevent recurrence. This usually involves using a vaginal antifungal cream or suppository periodically, such as once a week. Yeast infections are a common issue, but can be effectively managed and treated. Always consult your healthcare provider for proper diagnosis and treatment, especially for recurrent or severe infections.